Congestive heart failure, CHF. Introduction. Congestive heart failure, CHF, is a chronic, progressive condition in which the heart is unable to pump sufficient blood to meet the body's needs. This leads to a buildup of fluid, congestion, in the lungs, liver, abdomen, and lower extremities. CHF is a major public health issue worldwide, affecting millions of people, particularly the elderly. It results from structural or functional cardiac disorders that impair the ventricle's ability to fill with or eject blood efficiently, significantly reducing quality of life and increasing mortality rates. Definition. World Health Organization, WHO. Congestive heart failure is a complex clinical syndrome resulting from any structural or functional impairment of ventricular filling or ejection of blood. American Heart Association, AHA. Heart failure is a chronic, progressive condition in which the heart muscle is unable to pump enough blood to meet the body's needs for blood and oxygen. Risk factors. Age. Risk increases with age, especially after 65 years. Hypertension. Long-standing high blood pressure damages the heart. Diabetes mellitus, associated with increased risk of heart disease. Obesity, increases strain on the heart. Smoking and alcohol abuse, damages the heart muscle and blood vessels. Family history, genetic predisposition to heart diseases. Sedentary lifestyle, lack of physical activity contributes to risk factors like obesity and hypertension. Etiology. Coronary artery disease, CAD, blockage of coronary arteries reduces blood flow to the heart muscle. Hypertension, high blood pressure causes increased workload on the heart, leading to heart muscle weakening. Cardiomyopathy, disease of the heart muscle that affects its ability to pump blood. Valvular heart disease, dysfunction of heart valves, example aortic stenosis, mitral regurgitation, disrupts normal blood flow. Myocardial infarction, heart attack, damage to heart muscle reduces pumping efficiency. Congenital heart defects, structural abnormalities present at birth. Arrhythmias, irregular heart rhythms can impair cardiac output. Classification. Congestive heart failure, CHF, can be classified based on various parameters, including the side of the heart affected, the functional status, and the type of ventricular dysfunction. Below are the main classifications. 1. Based on the side of the heart affected. A left-sided heart failure. Most common type. The left ventricle is unable to pump blood effectively to the body. Leads to pulmonary congestion. Symptoms: dyspnea, orthopnea, pulmonary edema, fatigue. B. Right-sided heart failure. The right ventricle cannot pump blood efficiently to the lungs. Often caused by left-sided heart failure or lung diseases, cor pulmonale. Leads to systemic congestion. Symptoms: peripheral edema, ascites, hepatomegaly, jugular venous distension, JVD. C. Biventricular heart failure. Both left and right ventricles are affected. Combination of pulmonary and systemic congestion. 2. Based on the type of dysfunction. Asystolic heart failure with reduced ejection fraction, HFrEF. Impaired contraction of the heart. Ejection fraction, F, 40%. Causes include myocardial infarction, cardiomyopathy. B. Diastolic heart failure with preserved ejection fraction, HFpEF. Impaired relaxation and filling of the heart. Ejection fraction, F greater than or equal to 50%. Often associated with aging, hypertension, and left ventricular hypertrophy. 3. Based on functional classification, NYHA classification. The New York Heart Association, NYHA, classification is widely used to assess the severity and functional limitation due to CHF. Class. Description. Symptoms. Class I. No limitation of physical activity. Ordinary activity does not cause symptoms. Class 2. Slight limitation of physical activity. Comfortable at rest, but ordinary activity causes fatigue, palpitation, or dyspnea. Class 3. Marked limitation of physical activity. Comfortable at rest, but less than ordinary activity causes symptoms. Class 4. Unable to carry out any physical activity without discomfort. Symptoms may be present even at rest. 4. Based on the onset. A. Acute heart failure. Sudden onset of symptoms. Often due to myocardial infarction, severe arrhythmias. Requires urgent medical care. B. Chronic heart failure. Long-term condition that develops gradually. Managed with long-term medications and lifestyle modifications. Pathophysiology. Initial cardiac insult. Down arrow. Decreased cardiac output. Reduced blood pump to tissues. Down arrow. Neurohormonal activation. Activation of RAAS and SNS to compensate. Down arrow. Fluid retention and vasoconstriction. Increased preload and afterload. Down arrow. Left/right ventricular dysfunction. Down arrow. Congestion in lungs and systemic circulation. Pulmonary and peripheral edema. Down arrow. Symptoms of heart failure. Dyspnea, fatigue, edema. Down arrow. Progressive decline in cardiac function. Remodeling and worsening of CHF. Clinical manifestations. Left-sided heart failure. Dyspnea, shortness of breath especially during exertion or lying flat, orthopnea. Pulmonary edema, fluid accumulation in lungs causing cough with frothy sputum. Fatigue and weakness, due to inadequate oxygen supply. Nocturnal dyspnea, PND waking up breathless at night. Tachycardia and palpitations, as compensatory mechanism. Right-sided heart failure. Peripheral edema, swelling in legs, ankles, and feet. Hepatomegaly, enlarged liver due to fluid congestion. Jugular venous distension, JVD bulging neck veins. Ascites, fluid accumulation in the abdomen. Weight gain, due to fluid retention. Diagnostic evaluation. Medical history and physical examination, assess for symptoms, risk factors, and signs of fluid overload. Echocardiogram, evaluates heart structure and function, ejection fraction. Electrocardiogram, ECG detects arrhythmias, previous MI. Chest X-ray, shows heart enlargement and pulmonary congestion. B-type natriuretic peptide, BNP, test, elevated in heart failure due to ventricular strain. Cardiac MRI, detailed imaging of heart anatomy and function. Stress test, evaluates cardiac response to exercise. Coronary angiography, detects blockages in coronary arteries. Medical management. ACE inhibitors, example enalapril, lisinopril reduce afterload, improve cardiac output. Beta blockers, example metoprolol, carvedilol slow heart rate, reduce workload. Diuretics, example furosemide, spironolactone remove excess fluid, reduce edema and pulmonary congestion. Angiotensin II receptor blockers, ARBs, example losartan alternative to ACE inhibitors. Aldosterone antagonists, example eplerenone reduce fluid retention and prevent cardiac remodeling. Vasodilators, example hydralazine reduce vascular resistance. Inotropic agents, example digoxin improve myocardial contractility in severe cases. Surgical management. Implantable cardioverter defibrillator, ICD prevents sudden cardiac death due to arrhythmias. Cardiac resynchronization therapy, CRT coordinates contractions of heart chambers. Coronary artery bypass grafting, CABG restores blood flow to heart muscle. Heart valve repair/replacement, corrects valve disorders contributing to CHF. Heart transplantation, for end-stage heart failure unresponsive to treatment. Rehabilitation and supportive care. Physical therapy, cardiac rehabilitation to improve endurance and strength. Occupational therapy, help adapt to daily activities and conserve energy. Dietary management, low sodium, low fat diet to reduce fluid retention and improve cardiovascular health. Psychological support, address depression and anxiety related to chronic illness. Patient education, medication adherence, weight monitoring, fluid restriction. Nursing management. Nursing diagnosis, excess fluid volume related to compromised regulatory mechanism. Monitor daily weight and intake/output. Administer diuretics as prescribed. Educate on sodium and fluid restriction. Nursing diagnosis, decreased cardiac output related to impaired myocardial function. Monitor vital signs and heart sounds. Encourage rest and activity balance. Administer prescribed cardiac medications. Nursing diagnosis, activity intolerance related to fatigue and dyspnea. Plan activities with rest periods. Encourage energy conservation techniques. Provide oxygen therapy as prescribed. Prevention. Control hypertension and diabetes. Adopt a heart-healthy diet, low in salt, saturated fats. Regular physical activity. Avoid smoking and excess alcohol. Routine cardiac check UPS for high-risk individuals. Weight management to prevent obesity. Complications. Pulmonary edema, life-threatening fluid accumulation in lungs. Arrhythmias, can lead to cardiac arrest. Renal failure, due to poor perfusion. Hepatic congestion, from right-sided heart failure. Thromboembolism, risk of stroke, deep vein thrombosis. Cardiogenic shock, severe pump failure. Conclusion. Congestive heart failure, CHF, is a chronic, debilitating condition that requires lifelong management. Although there is no cure, early diagnosis, appropriate medical and surgical management, lifestyle modifications, and multidisciplinary care can significantly improve quality of life and outcomes. Nurses play a critical role in monitoring, education, and support for patients living with CHF.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.